recording, and I'm going to kind of introduce the three people that were lucky enough to kind of help us and join. And I'm really thankful because they're actually pretty motivated and stuff. So I'm gonna have them introduce themselves, and these are three people from the pre-med med panel that I actually organized.
Hi guys, I'm Danya. I'm a sophomore at St. John's University. I'm a biomed major on a pre-med track, and that's enough that I have to say about me.
Hi, I'm Aditi. I'm a incoming junior at the University of California, Berkeley. I'm majoring in molecular and cellular biology, and I'm also on the pre-med track.
Hi, I'm Nicolette, and I'm a student athlete at the University of Redlands. I am majoring in our Health Medicine and Society program, which is a sort of interdisciplinary pre-med major, and I'm also minoring in biology and psychology, and I'm also going to be on the pre-PA track, so a little bit different than Aditi and Danaya, but I can offer those tips for anyone who's pre-PA.
So let me share screen and actually get started on the presentation. Okay, so let me press present. Okay, so this is the pre-med panel shadowing with the three of us. This is just an introduction of all of us. We've already stated who we are. Okay, so let's start with where can I find which prerequisites I need to complete. So from high school to colleges, it says most undergraduate colleges require the same classes. These will typically be your graduation requirements. Almost everywhere is going to have like the same type of classes that you have to do. Just make sure you're getting all the required prereqs in before you go into college. So again, these may vary state by state, so make sure you contact any potential colleges' admissions offices to make sure you meet all of the requirements. A big thing that high schoolers don't like to do is email or call college admissions, but is actually a really good thing for you to do. It can show your motivation to go to the school, and also you can always just find this online. Just search up the college you want to go to and search up undergraduate admission contact, and you can find the email or the number that you can call. But with COVID happening, you'd probably want to email them. So from college to graduate school, prereqs will vary by type of graduate degree, state, and specific school. So for example, if you're going in as a pre-med and you're planning to go into med school, that might be different if you're pre-PA or pre-vet, pre-dental going into whatever school you're going to go to in the future. So please make sure that you research what school requires what prereqs. Any school that you're interested in, different schools require different things, although they all might be like the same general thing. Like with pre-med, you might have English and you might have to take English and bio and anatomy. There's still certain things that there's still certain classes that they can recommend, like molecular biology or genetics, and just make sure you're getting all of those at hand. Of course, you can either contact the school directly or you can research programs directly and just find them under the program's websites under admission requirements. Oh, let me go next. Okay.
Okay, so what can you expect in college as a pre-medical student? College is a really fun experience, and being pre-med doesn't mean that you need to miss out on all those fun memories that you can make. So make sure you make friends and be social and join clubs that you're interested in and find your people. For the work part of college, as much as there is fun in college, there's also a lot of work and reading that you have to get through. Exams make up most of your grade, which means that you need to stay on top of the course and keep up with studying. So make sure you don't procrastinate on anything. If you need help, make sure that you ask for it soon. Depending on your high school rigor, some students find the transition from high school to college really difficult. Find the resources on your campus, such as tutoring and office hours, to help you throughout your college experience. Time management is also very crucial in college, so you will have much more time outside of class to do what you want. But make sure that you prioritize your activities and give yourself a balance between work and play to make your college experience amazing. So do you have to be a doctor after being pre-med? The answer to that question is no. You definitely aren't tied to entering the life of a physician if you choose to be a pre-med student in college. There are so many other wonderful opportunities and careers that you can go into, and this slide lists a few of them. Since a lot of the classes that you take being a pre-med overlap with the knowledge required to take any of these jobs, being pre-med doesn't determine which path you eventually end up going into, as there are so many countless options that you can take. Some people have also asked questions about how you choose which career you go into, and the answer to that is definitely by shadowing and knowing personally like what you want to do and what you want to achieve in life. If, for example, you shadow a physician and you feel that their lifestyle is not for you, then you can check out the life of a nurse and see if that is better fitting for you. It all depends on your experience and what you want to do for your future career.
So the transition to college is really difficult. It's definitely a learning curve. The more time you spend on campus, the more of an easier time you'll have, because you learn how to navigate the environment, the schoolwork, and the general culture of your campus. So I plead with you guys, don't feel ashamed or frustrated if you feel like the transition is taking longer than you would think. But fortunately, after years of navigating, me being a student athlete, and although I haven't been the star student, it's been a learning curve for me as well. But luckily, I've identified some important tips and tricks for everyone to try. So on the right-hand side of the screen, you'll see some of those tips. So my most favorite thing is to get a planner. I have both a planner and a whiteboard calendar, and the whiteboard calendar has become my prized possession. So make sure that you're writing all the important things like test dates. For me, I had to write a lot of practices and games. On planners, you can be much more in depth because you can be future oriented, which is my favorite part. So when you get your syllabus on your first day of class, make sure you go into your planner and write down the future test dates, final dates, and to make sure that you look ahead and see, do these dates overlap? Do these tests overlap? You need to make sure that you're planning for that and communicating with who you need to. My second tip would be to always make friends in your classes. This helps make class much more enjoyable, and of course makes getting assignments done a lot easier. This way, study groups can also be like a hangout with your friends, so you're not dreading oh, I have to study. It's like you're with your friends, so it's a little bit more enjoyable for you. This tip is especially applicable to people in your STEM classes. So as pre-med students, we basically take very similar science classes. So if you have someone in your introductory bio class, odds are you'll have them in upper division biology classes as well. The third tip is to always acknowledge your mental health and learn the symptoms of burnout. So most schools do offer short-term counseling services and support groups, so please take advantage of these resources. Another tip for this is to make sure you make contact with these services in the fall of your freshman year so that you're already in their system, and it's so much easier to get an appointment later on down the line in your junior year, senior year, or just later on that year. For the fourth tip, it's a hard pill for some people to swallow, but you really do have to become more outgoing. For me, this is super difficult, but college is really a time to venture out and explore your limits. So it's going to have to happen sooner or later, but being more outgoing and assertive will help you not only have more fun, but it'll also increase your chances of having the best educational experience. For me personally, I'm the type of student to ask 30 questions a day in class, and there's never a class where my hand is down the entire time. So you just need to learn that you must ask questions, you must participate, and you must be vocal about what you need. And last but not least, please acknowledge your passions. In college, there's so many more activities, people, and programs that you can get involved with. There's going to be something for almost every interest or passion. And if you allow time in your day for something that you truly love, it'll make you such a happier person, and it'll also push you to become more organized. Go to the next slide. Okay.
So how can I get shadowing and volunteering opportunities? So the other thing with college is that you have to go out of your way to go outside of campus to do different opportunities, especially if you're going into the health field. You have to sort of go to the hospital or go to the doctor's office and do things to show that I know what the medical field is like and I know what I'm getting myself into. So how can you actually get shadowing and volunteering opportunities? So shadowing is one of the best things, honestly, that you can do. What makes it so important is that you not only learn so much about the field. So for example, you know what a doctor or a PA or a dentist, whatever, they do day to day. So you can see firsthand what's going on, and you can see and assess for yourself if you really want to go into that career. I'm currently like at a hospital, well, not at the moment because of COVID, but before COVID, I was shadowing a surgeon at Long Island Jewish Hospital in New York. And I would have to get up really early. And by really early, I mean like around like 4:30 to actually get there by 7:30 because it takes like 2 hours to get to the actual place. And you have to sort of get used to, is this what you want to do? Do you really want to do this? And it sort of assesses how you would like to do it. So how can you actually get started with these opportunities? So you either have to connect directly with the person you want to shadow or talk with the receptionist / volunteer office. I always recommend finding out where you want to shadow, like find out where you want to shadow. If you want to shadow at a specific hospital, go there directly and talk with the receptionist or anyone at the front desk and be like, I'm interested in shadowing. Is there any way I can talk with the doctor that I do want to shadow? Or is there like a volunteer office I can go to where I can actually apply to be a volunteer? Sometimes it also comes in with connections. So if you have a person who can directly contact you, like directly connect you with a doctor, with a PA, with anyone, like make sure you get on that opportunity, so it makes it so much easier for you to get the opportunity. So talk face to face is something you should be doing because they can see who you are and how you are as not only as a student. Remember that shadowing is a learning opportunity. The doctor that you're shadowing, the person that you're shadowing from the medical field, from the health field itself, that's your mentor. That's your mentor. So please, whatever you do, try to go face to face. But because of what's going on right now with COVID and in general, if you feel like you're too scared to actually talk face to face, talk over the phone if you can and slowly get used to talking face to face. With shadowing, a really important thing that you have to do is ask questions. The person you're shadowing, they're there to help you. They're not there to hate you. They took you in as a student because they want you to learn. So you can ask them about how college was like for them, how medical school was like for them, how PA school was like for them, anything, and they'll be happy to help you. So don't feel like you shouldn't talk to them or that you should just see what they're doing. Like question what's going on, like what are you doing here, why did you do this? Usually do it after like the patient leaves so that you're not bothering them during their time with the patient, but keep those in mind. And also dress professionally when you do shadow, because you sort of like you have to dress business casual. Get yourself some nice dress pants from like H&M and like a cute top, and just be as professional as you can be. So now we can open it to any questions. Let me stop screen sharing and we can go to the chat and see who has questions.
Okay, guys, just a quick reminder, you guys shouldn't be asking questions when people are presenting. Just overall, it's just not really professional. And we told everyone to do it at the end. This is just a learning experience, so please be mindful because they worked really hard on their presentations, so it kind of detracts from it as well. So now you guys can actually ask questions, and I will be also answering questions that you guys have about this kind of pre-med, the pre-med board, if you guys have any questions about that, or kind of the webinar itself.
So is there any questions? First of all, does anyone want to ask any questions directly? So we should, if you have any questions, unmute yourself and please tell us any questions that you may have.
So I'm just going to go ahead and answer one of the questions that was in here for me. So personally, like from Miranda, she asked, why did I pick PA school versus med school? For me personally, I didn't really want to be stuck in medical school for about 6 years before I could actually start practicing. I really wanted just to go get into the field as soon as possible. Also, PA school is a lot cheaper than medical school. I didn't want to be, $400,000 in debt by the time I was finished with my residency. So that was a big plus for me. It's also much, much shorter. So PA school is typically around 2 to 3 years. And also a really good perk is that you can switch specialties at any time in your career as a PA. You are not, tied to one specialty your whole entire life. You can switch anytime you need to, as long as you find a doctor to practice under. So Lisa asks, could you talk more about what it means to be a PA and the different similarities between a PA and a physician? So a PA is a physician assistant, and we technically do the similar daily activities as a physician. We just practice under their license. So I wouldn't have an MD, I would have a master's in physician assistant studies, and I would do similar roles as a physician, but I'm not allowed to do the entire scope of what they do in that certain hospital, that clinic. I'm a little bit limited, but you can practice on your own. You don't need the doctor there with you the entire time. You're given some leeway and some freedom as to what you want to do. But if anyone has any more questions specifically about that, go ahead and ask them in the chat.
Also, Nicolette, do you want to do that? You want me to go back to slide 7 so you can talk about what you need to talk about?
Sure, because yeah, we can go back to that slide.
Realize. I probably
Okay.
skipped over it. Hold on.
So we actually skipped over one of my slides a little bit, and I'm sure people want to hear about this. So
So yeah, talk about it.
So for this specific slide, a lot of people had questions about how to become a competitive candidate. This can be for either undergraduate or graduate school. So besides being a really strong student, there are lots of extra things you can do to make yourself competitive in the applications. So you really want to be well-rounded. You want to volunteer, tutor, mentor, play sports, which is what I did. You can start a club or be a member of a club. This really shows them that you can handle, a really heavy workload, as well as being involved in lots of other activities. The next thing is to show that you're really a hard worker. Generally, admissions offices love an upward trend. So in my personal experience, in high school, I took honors math analysis and I got a C my first semester. And I knew that I could not get any scholarships if I had that C, 2 C's. So I really knew that I needed to improve on that. So for 2 months, I went to a previous math teacher's classroom, and I was there every day at lunch, and I showed that I could work hard to get that B+ that I ended up getting that next semester. And when I was accepted to the University of Redlands, which is where I go now, they told me that they really appreciated that upward trend. So the next part ties into good grades, but focuses more on the tests. So whether you are taking an average in-class exam or a big standardized test like the SAT, the ACT, or the GRE, you really need to hire a tutor or get a test prep book. And I know that it's a huge financial hardship, and we can go into all about how the standardized testing industry is kind of a scam later on, but all I can do is just try to prepare everybody for the unfortunate reality of these tests, which is having a tutor and having those prep books really, really increases your chance of getting that competitive score. But for normal exams, always implement good study habits, try different studying methods, and find which one fits best for you. For me, I personally love flashcards and the spacing technique. So if you want to try those, you can look it up, figure out how to do it, and try it. It might really help you.
All right.
Sorry. I'm almost done. Last but not least, be really vocal and put yourself out there. You have to reach out, like Denaya was saying earlier. You need to put your name out there, put your face out there, and it will make such a huge difference in your education. Okay, we can go back to the Q&A now.
Okay, so I'm just looking through the questions to make it easier for you guys. So someone actually asked about pre-med resumes and stuff like that, so kind of your advice on it. So if the other two want to answer, you guys can.
So for pre-med resumes, I think the best thing that I did, so if you're going into college, you usually make your pre-med resume when you're in college. The best thing you can do is that if there is career services, so there's like usually a place called career services. That's in my school at least. Some other schools have it where they will read over your resume and actually check to see if it's the best resume that you can make. You can always email them with their resume and have them see what it's like. In your pre-med resume, you're going to have any volunteering that you did, any research that you did, any shadowing that you did. If you're doing shadowing, you usually want to put it under education because that is a learning experience and it's not really volunteering. You're not working with anyone. So please make sure to, what was I going to say? So please make sure to put that under education. Things like research, if you do have research, make sure to put that on as well, as that's really important. Any sort of volunteering, any clubs that you're a part of, especially like medical-based clubs, you can put those down as well. If you're, make sure that you're like, you know, a board member. Being a board member can really. So what are any other questions that we might have? So someone asked, can you shadow in high school? Yes, you can shadow in high school. I forgot to say this, but one of the best things you can also do is go to your pediatrician, for example, or go to the doctor that you usually go to and ask them if they would be happy with having you shadow them, because it's going to be so much easier for you to get that experience, and it's usually not as hard. Like I shadowed my pediatrician my junior year of high school, I believe. Yeah, the summer of my junior year. So yeah, you can shadow in high school. Just start off with probably the doctor that you already go to normally, like annually, and it's pretty easy to get shadowing from that.
There are also preceptorship programs that are offered in high school, especially like in my area. So you could like look out for those and see like on Google if there are any in your area to see if you could do shadowing. And preceptorship programs also, they focus on a variety of different aspects in the medical field, so not just like a pediatrician versus like any other doctor. So you could try doing that as well.
Okay, so I think the next one is for Nicolette. It says, which school would help you prepare for PA school the best during your undergrad? A CSU, UC, or private school? And can CSU students research at UCs, or is it solely to UC students?
So I think that all three of those schools, either a Cal State, a UC, or a private, would prepare you perfectly fine for a PA school. You don't need to go to an Ivy League in order to do well in PA school at all. Just make sure that you're getting the classes that you need. You know, it's typically, you can find them on the PA school's their website and the admissions requirements. And I'm not exactly sure about the UCs and the research. Typically during the school year, they only allow students from their own school to become research assistants. But I know that sometimes they have summer programs at bigger schools where you can apply and join from any school really. So you really just need to do that research and make sure. But typically summer is for everybody, and during the school year, it's typically only the people that go to that specific school.
Okay, sounds good. Another question is kind of the three of your guys' extracurriculars and any study tips. So we can make this a little short, like either 2 to 3 main ones that you guys have.
So for me, my extracurriculars are, I'm a board member for a pre-medical co-ed fraternity on campus. I'm the event coordinator for SJU Medical Roots, and I'm also vice president of a book club. I'm also part of the Honor Society for Biological Sciences, as well as I research with my chem professor. Any study tips that I have, I always try to review everything that I do for classes, especially for my like science and math classes, the day that I'm given the problem. So if we have class that day, I review immediately that day. It just makes it easier. So like the week before test week, I can just sort of look over what I did and do any practice problems and not really have to focus on the concepts as much.
Me personally, my main extracurricular is sports. I'm also right now in 2 clubs, a mentorship and a pilot program for tutoring. My main study tip would probably be to get those flashcards. I think a lot of repetition really helps gets it stuck in your mind.
For me, I was a research assistant at UCSF doing glioblastoma research. I was also part of, well, I am a founder and choreographer for a Bollywood dance team at Berkeley. And I also am part of multiple clubs that focus on clinical procedures that we do at different clinics around the Bay Area, and also some clubs focusing on cardiovascular health.
Okay, the next one is, so why did you guys choose kind of pre-med or pre-PA? Basically, why?
So that sounds like the medical school application question. Like, why are you going to be a doctor, basically?
Yeah.
But basically, what I was interested sort of into neurodegenerative diseases, especially my my senior year of high school, and so I always had this like sort of interest into like being a surgeon that does research. But recently, especially with the issues going on right now racially, with the racial issues going on right now, I'm really interested in going into primary care to help battle systemic racism within the medical field, because I don't like, as a doctor, you're supposed to help everyone, but then there's so much of the racism within the medical field that you have to tackle. And not even racism, it's also sexism as well as xenophobia. I think someone also asked specifically, what if the provider asks for you to wear scrubs instead of business casual? Is the uniform at the discretion of the provider? To answer that, yes, it is. Usually, so I shadow a surgeon. So when I'm in the OR, I have to wear scrubs, but I have to come into the hospital. So I have to meet him at the hospital wearing business casual. If you're at like a small pediatrician's office, usually you don't really have to wear business casual, but especially for hospitals, it's a must. And it's always good to make that first impression like great, you know, just like you look professional, have that work out for you.
Okay. Next one is, do you guys have like paid internships around you, and how does that kind of work?
I have never had an internship. I've shadowed, I volunteered, I'm a lab assistant, but I've never had an internship.
Okay.
Internship like my junior year of high school, like towards the summer of when I was becoming a senior, and that was unpaid though, and I really hated it. Yeah, so do internships that you're really gonna like, because most of the time you're not paid for it, and if you don't end up like liking it, it's so much harder to do the work. So
Yeah, a lot of pre-med internships are unpaid, and they do require a lot of hours and time put into it. So if you don't like it, then you shouldn't go into that.
Okay, another question is, what do you guys like best about the pre-med track?
I feel like there isn't like, okay, so being a pre-med, it's like your undergrad before you try to get into med school. It's basically just trying to keep your grades up and just doing everything that you possibly can to prepare for med school. My favorite thing, I guess, is communicating with my STEM professors. So like communicating with and actually getting close to them, like they're humans after all, and sort of seeing how they are behind like not just like in the classroom, but as like your PI, or just as your as just someone like that you can talk to. Like I can walk into my gen chem professor's office and just say hi, and it's really nice to just talk to him and just ask him about what he's doing.
For me, I personally like the kind of culture within the pre-med. I know I've heard a lot about how it's very competitive and people are really mean to each other, but in my specific experience, I go to a rather small college. But I think everyone is really out to support each other, out to, help everyone get the grade that they want. So I really like how the support within that pre-med community.
Um,
I go to a really large institution, so finding people who are like-minded with the like medical side of everything is really like nice to have people like a support system. That's like my favorite part about the pre-med track.
all right, so the next question is, how do you guys pick where you wanted to go to college and what factors kind of played in your decisions?
I focused on finances basically. So when I did it, the biggest thing that I thought, because with med school and basically just like thinking ahead, I'm going to probably have to take out loans once I'm in med school. And I thought, what's the best thing for me to do is usually to go to the college that offered me the most money. So if I had to choose between those, I was choosing between Stony Brook and St. John's. So, but I think what ended up happening was that I wanted to go to Stony Brook, but I think like the day before decision day, basically, um, I, I like looked at my parents and I just sort of got sad. So I was like, you know what? St. John's gave me because there's some places like St. John's that gives you financial aid that can cover your entire tuition. And that's a merit scholarship. So they were covering my tuition. So I went, why not just go to that school and not have to pay as much? And I'll stay close to home. And I couldn't imagine myself leaving New York City. So I chose St. John's.
I actually was debating between a BSMD program and Berkeley, and I decided to go to Berkeley because I just thought it'd be like more beneficial for me if I like stayed close to home, and that I got a lot of like experiences and opportunities in the Bay Area, and also because it's a really large school, very like well-known UC, and so I thought that it would make my chances for med school a lot easier.
I kind of was a little bit limited in my choices because I knew I wanted to play water polo in college. So I had to, to pick something that I was being recruited by. But I basically just picked the cheapest school and I'm really happy about it.
Okay, so the next one is kind of how do you prepare for kind of the pre-med pre-PA track in high school? Like what classes and APs to take?
I think especially for pre-med, try to take AP Bio and AP Chem, because with AP Bio, even if you don't get the credit for it, or AP Chem, even if you don't get the credit for it, what ends up happening is that it makes your situation in college much better. When you take biology and when you take chemistry in college, like college chem and college bio, it seems sort of easier compared to AP bio and AP chem. But also sometimes I tell my students, especially like because I'm a mentor for high school students going into college, especially for like my lower income students, I tell them not to take APs and instead go to a community college and get your credits from there directly. It's going to be more beneficial. You can knock out gen ed courses as a high school student, and it's so much better. And so once you get into college, you can focus more on the different sciences that you want to take, like microbiology, genetics, neuro, anything of that sort.
I agree. Just take those AP courses. While they may not, cover the requirement in college, they really help you prepare. You're not going into a college level class knowing absolutely nothing about what's on that paper in front of you. So that's what I would say.
I think another question that we got was, do we have to take physics in high school to do pre-med? You don't need to take physics in high school, but it would be recommended because college physics is very, very difficult. So if you got like a background information on how to do physics and like the fundamentals of it, it would be much easier in college.
Okay, so another question is so the GRE compared to the MCAT, is it similar on what's tested? So kind of the GRE versus the MCAT.
I think that they're quite different. The GRE is mainly for, any graduate program, and people who go into like graduate programs for English or history, they take that. It's kind of like it's called the graduate readiness exam, I believe. So it's really wide, not really science, focused at all. But the MCAT definitely is focused. It's mainly for, if you're going into an MD program, I don't know a lot of PA programs that require the MCAT, but that is mainly science related. So I think Aditi and Danaya can tell you more about that, the MCAT.
So from what I know about the MCAT, so you have your chemistry questions, biology, physics, sociology, so things like psychology. I forgot to recommend take AP psychology, also AP calculus as well. Get calculus and stats out of the way if you can. So it's consistent of exam questions like biology questions, chemistry questions, physics questions, psychology questions, as well as there is a reading comprehension exam, which I'm dreading to even think about because I suck at reading comprehension. But it's a wide variety of topics that you have to answer, and it's extremely long. So one of my friends, he's going to med school now. He told me to study as soon as I got into college. So if you do plan on taking the MCAT, please plan ahead and don't do it so close by. Like, make sure you're preparing for it as you go along in college.
So the timeline for the MCAT is if you're applying to med school without taking a gap year, you take the MCAT after your junior year of college. So I'll be taking mine in January. You can take it like in the span between like January to like June when you apply to med school. And so for the MCAT, it's an 8-hour long computerized test. And I think for COVID, they have like shortened the test for I think 5.5 hours. But basically, like Denai said, it's every single like science subject, like anatomy, physiology, like all of that stuff is included in the MCAT. So and also like for preparing for the MCAT, you don't need to study like a year in advance or when you start college. I think it's better to take courses that you have in college to get introduced to the material that's going to be on MCAT. So people say to start preparing for the MCAT 6 months in advance before you take the test.
Okay, so another question is, do any of you guys have jobs in clinical settings such as EMT, medical scribe, CNA? If so, how long did it take to get certified to obtain these jobs, and how do you balance it with school?
I don't have one, but I'm trying to apply for one. So I'm trying to go either for scribing or for EMT. For scribing, it's basically you just apply for the job, and usually you have to take a typing test, and later on sometimes you have to shadow the previous scribe that was there before you to know how scribing would work under the specific doctor, because it varies between doctor to doctor how they want their notes done. But for EMT that I'm planning to take, so you're going to have to get your CPR certification. You're going to have to do a semester at a college of your choice that has an EMT program in it, and you'd have to take an exam right after, as well as a practical exam, and then you would become an EMT. So it's a little lengthy, so you can start it whenever you can, but just know it might take some time to actually become an EMT.
I don't have a job in a clinical setting. I have a job in a laboratory setting. But next school year, I plan to get one of those clinical jobs. You need them for PA school. You need what's called patient care experience, which is where you need to be actually physically working on a patient. The best way to get this is to be a CNA, a medical assistant, a phlebotomist. Scribes, some places accept, some do not. You can be an EMT, a physical therapy aide. There's lots of ways to get them, but typically you need a certification.
Okay, so the next two questions I'm just going to answer myself just to keep it short. So how to start research in high school. So I'm actually in high school right now, and I started research this summer. So because of COVID, I actually had to do it by myself. So I actually did kind of a psychology research about the correlation between dreams and productivity. So and then I was able to actually email professors from the colleges that I live around, asking them to kind of review the research paper. So you can still do that. It might take a little while for them to get back to you, but in a general year, probably next year, if you guys are looking for research, you guys should cold email. So you should cold email, figure out what the professors are actually teaching in those subjects, whether it's psychology, if they're, kind of doing research towards where you want to do research, and you email them. And it has to be a formal email, but you can find a lot of templates on YouTube on how to cold email. And as for where to get a tutor, there's colleges that also offer a lot of tutoring platforms, as I'm pretty sure there are. And as for medical wonders, we're actually still having applications. If you guys have any experience in anatomy, physiology, psychology, or computer science, you can apply through our link tree, and you guys can be a tutor and actually gain volunteer hours and actually gain a leadership position as well. So if you want to get tutored, we also have another application that you guys can sign up for in all of the subjects in high school itself, all STEM related subjects. So you guys can also do that as well. Okay, so another question is, would you recommend health sciences or public health for a pre-med track?
It doesn't matter what you major in as a pre-med. Because what ends up happening is that all you have to do is take the prerequisites and then take the exam and then apply, and then that's how you become a pre-med. That's how you get into medical school. You can be an English major, you can be a philosophy major. So whatever you're interested in and whatever you think you're going to be better at, whatever is going to raise your GPA basically, that should be what you should do. But also remember to take your prereqs. So take your biology classes, chemistry classes, all those classes.
Okay, so next one is kind of about BSMD programs. I don't know if you guys applied to them, but if you did, how many and like what type of ones did you apply to?
Yeah, I applied to the Brown PLME program, and I also applied to Cal North State, which is in California. BSMD programs are really good for if you are determined to become a doctor and you know it's what path you want to go down, since they are like 7-8 years and they combine med school with them, so you don't have to apply. Most of them you don't need to apply, and you don't even need to take the MCAT either. So you can apply to those programs if you're sure that you want to go into med school.
Okay, next one is, what classes do medical schools really like you to succeed in or are really important for the process?
All your classes, basically, but you have to show that you're doing well in all your classes. Obviously do well in your STEM classes, but because think of this as something, in order to go into med school, you're showing that you're well-rounded. Obviously, if you don't do well in one of the classes, but you showed significant growth, it's going to be so much better for you. And it's going to show colleges a lot, but it's not really just like what classes are going to make you look better. It's just take all your classes that you can and make sure you can show that you're doing relatively well in them.
Okay, so next one is, do you recommend working during PA school? I'm in my senior year and plan to take a gap year to save money, but I know it will not be enough, and I had a 3-year-old, I think. What are recommendations for single parents on working during a didactic year?
So in most PA students that I've talked to, PAs themselves and the PA programs, unfortunately, they don't recommend working during PA school, which I know is like sucks because PA school costs a lot of money and it's really hard, but everyone that I've talked to has to take out loans. I'm not in PA school yet. I'm still in undergraduate school, so I don't have any tips on didactic year, but the main consensus is not to work during PA school.
Okay, so I think we answered most of the questions. So I'm gonna pull it up from people that kind of did it from the Google form. So one question for Nicolette, it's if you have any tips or advice on how to manage time well and be prepared for the pre-PA track.
So for the time management, always plan ahead. Make sure that you have everything written out, because especially in college, if you're involved in all these different activities, the dates and the times can get very jumbled up if you're just kind of committing it all to memory. So I would say write everything down. Try to have as much fun as possible. I think the main thing that helped me kind of enjoy both school and, the fun part, the sports part, is to make friends in every aspect that you're involved in. Advice for being pre-PA, I would say make sure that you're prepared, make sure that you're doing, all your pre-requirements. Make sure that you get those checked on the PA program website. And for me specifically, I've reached out, networked with a couple PAs and PA students to help give me tips. So I think finding a PA to mentor you, finding a PA student to mentor you will be really helpful for preparing you for that track.
Okay, and then the next one is, did you take any SAT subject tests? If yes, when do you usually take them?
Yeah, I took two my senior high school. I took the math level 2 and then the biology, I think the molecular one. I think it's important to take subject tests so that you know, like colleges know you have an expertise in like science courses. If you're going to be pre-med, I think it's a good way to show your application to colleges.
Yeah, I did the same thing. I did math level 2 and biomolecular. I did it the end of my junior year because my AP Bio teacher taught us immediately all the subject test material. So I did my my subject test immediately.
Okay, so another question is it bad to use AP credits for pre-med requirements, or can you actually do that?
No, I don't think any medical school like takes AP credits. Most of them require you to take college courses in college, so you know, like they know that you have an expertise in those college courses. So I would not recommend using AP credits for college for med school.
Also, it's going to be so much easier when you go into college to actually take the course and then show that you did well, and you might actually remember it during the MCAT, except for when if you were to go to high school and you forget most of the things.
So another thing, you guys can kind of answer on the college side, like with everything going on in Corona, how do you kind of get a research opportunity in high school or college, like with the whole COVID thing that's going on, besides what I said?
Like for St. John's, I think we closed labs at the moment, so there's no research going on within St. John's, but it can vary within college to college. Honestly, you cannot. Because I got it just by talking to my professor, and he desperately needed a research assistant, so I was there and I was like, hey, I'm interested in research, but with COVID going on, you probably do have to wait a little before you either ask, or you can ask directly and see, ask your professor directly and be like, hey, I'm interested in research. With Corona going on, what can I do? So like email them as much as you can.
Berkeley especially does like a research apprentice program during the school year. So they're doing it online this year, and it's a good way to get research even if it's like online.
Okay, so I think this is for Denia, but as a biomed major, what does your regular day consist of?
Since I'm from St. John's, we are a Catholic school, so my day consists of taking theology as well as English classes. So my main classes are theology as well as English, but biomed, as a biomed major at St. John's, we have a very strict and rigid schedule and we have specific classes that we have to take, and we have to take them within specific years, because it's such a rigid major and it's a really difficult major. So it consists of me not only doing my theology and my English classes, but it also consists of me doing my pre-med classes, so doing things like chemistry and anatomy and things of that sort.
Okay, sounds good. And another question, I'm just scrolling through right now. Do you guys recommend majoring in BME, so biomedical engineering, for pre-med?
As I said, you can major in anything. So if you're interested in biomedical engineering and you think you can do a good job within biomedical engineering, certainly just go for it. Even if you don't think you're going to do a good job, you know what? If you really like it, just go for it.
There's a lot of overlap between like pre-med recs with BME. So I think if you are really interested in it, then you should go for it.
Okay, any last questions? I think we answered everything, but if we didn't, then you guys can just recopy and paste your question.
Someone asked, do you think that if I go to community college, my chances of getting into med school are limited? Or any tips for people going to community college and pre-med track? And I'm going to say that it doesn't matter where you go for undergrad. I feel like the best thing that you can do is remember that it doesn't matter about how good your school is if you go to an Ivy or not. It just matters how well you do and what you make of yourself, because medical school isn't trying to just pick up like the kids from the best schools, or like the richest kids. Sometimes like you can always set yourself out as, I went to community college, but I did this, and this, and it made me want to be a doctor so much more.
Okay. Yeah, Nicolette, you can go.
So Lisa Kim asked, can PAs perform surgeries and assist in surgeries? Yes, you can. Typically with surgery, you have to have an MD with you, but yes, PAs can perform and assist on surgeries.
Okay, another question is, do you guys plan on studying abroad?
My dad wanted me to. I don't know why. He wanted me to go to Paris. He was like, why aren't you studying abroad? Like my dad and my mom. But I'm not, because it costs money and the COVID situation. And I don't think I want to study abroad. Also, I just want to really just focus on what I'm doing in New York City. And I feel like I'm doing like relatively good ECs. So I'd rather not go to another country right now.
I was planning on going to Ireland for physics this summer, but then I couldn't because of COVID, so.
I was supposed to go actually this fall, but I got it pushed back to the spring. So hopefully I get to go abroad at the University of Melbourne in the spring.
Okay, we're gonna take like 2 more questions because we're reaching the hour mark, but another one is, if we are not able to have time to study for the SAT subject tests and take them, would that lower college admissions? Because, you know, like COVID has been going on and they've been canceling a lot of the standardized tests.
Especially with the fact that that COVID's happening, a lot of colleges are going very easy with testing. So SAT subject tests aren't a requirement. They're a requirement for some schools, specifically for some campuses on some colleges, but majority of the time they're not really needed. So if you cannot take it, just don't take it. But if you really want to take it, then you can try to take it if you want to.
Okay, the next one is, what careers and jobs can someone do as a biomed major?
So our campus is known for pharmacy as well as PA. So the Biomed Major that I'm currently in used to be the PA program. St. John's is very much known to go directly into PA right after college. So you can go into any sort of health profession. I actually had to do that. I actually had to take a class on different things I can take with my degree, like last semester. It's really boring, but you can go into nursing. You can go and work in a retirement home. You can work within the clinical science profession, the health profession, or basically anything you want, basically. If you want to go to graduate school, you can go to graduate school.
All right, so I think we're gonna end it here. If you guys have any more questions, I guess the 3 of them can kind of leave their emails or Instagrams in the chat. You guys can do it really quick. But I actually have a poll while they're doing that. I'm gonna send it out right now. It's just to kind of get feedback on how the call was and the smoothness, and if we should record the rest of the Zoom calls. So you guys can just quickly put that in. So we can see kind of what we need to improve and stuff. And if you guys have any other questions or concerns, just like let us know or let me know, and you guys can definitely contact the pre-med panel for any questions and stuff like that. I'm sure they'd be willing to help. So the majority is the call went great and good, and the smoothness was good, and yes. So we are going to be recording the rest of the Zoom calls as well, and so far everything looks good right now. Yeah, please thank them. Thank you guys so much for kind of coming on for an hour and helping them. I'm sure a lot of people gained a lot of insight on that. And yeah, you can see the chat flowing, but yep, you guys are good to leave now. Just in a week or so, I'm gonna be kind of putting up the YouTube and kind of setting the calls up. I'll have someone to do that, so just stay tuned for that. But thank you guys so much, and stay tuned for tomorrow at 10 a.m. Bye.
Bye, guys.